I don't know what would possess anybody, because there's obviously the stigma that's out there. If you smoke while you're pregnant, that's going to have detrimental effects on your kids. So why would vaping be any different? You're just putting unknown chemicals into your body, not thinking that the other person that kind of relies on you to maintain a healthy disposition for 9 months, and then also longer than that if you're going to be breastfeeding, wouldn't you think that you would, want to have the most healthy situation for your offspring? But these women nowadays, it's all about them and being able to post their kid on the gram for likes. But that's a topic for the main channel. I'm just here to give you the health side of this stuff, and I don't see any benefit to smoking on those little robo dicks that you got to charge up. Like, okay, smoking's always been like a zero benefit activity that I don't understand, and I never will. Oh, you look cool. So do people just before they get hit by a bus. It's a great photo opportunity. So here we have a real horror story. Another warning to pregnant vapors. Healthy woman, 28, suffers deadly lung hemorrhaging and has to have an emergency C-section due to a regular e-cigarette usage. Fantastic. There's a reason I don't date seriously any girls that smoke, drink, or do drugs. Doctors are warning about the dangers of vaping during pregnancy after a Texas woman nearly lost her baby and died following a fatal reaction to the device. A 28-year-old who was otherwise healthy, okay, so that's very important, okay, was forced to have an emergency C-section at 36 weeks. Holy! After suffering severe hemorrhaging in her lungs. The internal bleed is thought to be caused by repeated damage to the blood vessels that carry oxygenated blood to and from the heart. A long-term and regular use of vapes exposes the lungs to a cocktail of chemicals and volatile compounds that can wreak havoc on our cells. Yeah, of course, but it tastes like frozen raspberry, bro. It's so tasty and good. A woman was severely oxygen deficient and had a rapid heartbeat. Yeah, no doubt, if her lungs aren't working, it serves to reason. When antibiotics failed to work and her condition got worse, doctors had to perform an emergency cesarean section in order to save her unborn baby's life. Doctors at Texas Tech University Health Science Center in Amarillo, Texas, detailed the tale in a case study published in the American Journal of Medical Sciences. They wrote, there has been very limited published literature on the adverse effects of electronic cigarettes despite their introductions in 2007. Gee, I wonder why that's not the case. It's almost like Big Tobacco, with all of their lobbying money, had the opportunity to try to sneak in a new product that would try to go as unregulated as possible, get them hooked on something, and then eventually get around to moving on to the next thing. The use of vaping has overtaken the standard electronic cigarettes in our current time, and it has been challenging to understand the health risks, and they have, due to the rapidly changing design and lack of long-term follow-up. Yeah, see, that's what they're doing right now. It's just a little shell game. It's kind of like the Scorsese film Casino, where Ace Rothstein just continues to get different job titles, so the government can't ever really track him down. Pregnant patient's husband, yo, what's this simp talking about? Confirmed she had been vaping regularly during her pregnancy and had shortness of breath. Yo, this dude is totally cucked. Yo, if that's my kid, none of that degenerate behavior is going to be happening. But then I also wouldn't be putting a baby in a chick like that. But that's just me, man. I got standards. Vaping and using other smokeless tobacco products during pregnancy have been disastrous consequences even after the baby is born. Researchers in Sweden recently determined the pregnant women who used snus, type chewing tobacco, increase the risk of their baby dying before its first birthday by 70%. Yay! E-cigarettes are laden with mysterious chemicals and volatile organic compounds that coat the lungs in harmful chemicals, causing irritation and potentially irreversible damage. But we don't know because none of the tests are running, because nobody's incentivized to run said tests. In fact, they're discouraged from it. Vaping also carries many other health risks, from lung scarring to other pulmonary injuries to asthma and cardiovascular damage. But it's safer, bro. That's the argument that a 40 caliber shot is safer than a 45. It's like, it'll kill you pretty easily, though. Nicotine in e-cigs has been found to directly injure a baby in utero by causing abnormal lung, heart, brain, and immune system development, which carries lifelong consequences. Oh, great. So instead of the old flipper babies, the old thalidomide kids from back in the cut with a little deformed appendages, now into the 2020s, into the 2030s, you're going to have little Timmy Tough to breathe, coughing and wheezing while, crossing the classroom. Holy. Pregnant woman who remained nameless in the case report couldn't be asked for questions because she was too busy sucking on her vape, you degenerate. Appeared at the hospital in Texas complaining of shortness of breath. The doctor did not disclose how long she had been experiencing her symptoms, but it's all right, some background. It was then consulted with her husband, who told the doctors that she was a regular vapor. Their conclusion was that the patient was having vaping-induced platelet dysfunction and strongly advised her to quit. You can't tell me nothing. I'm a strong, independent woman. I don't need no man. Ugh. They wrote, given our patient had a negative autoimmune workup, normal platelets, and the normal coagulation profile, we are hypothesizing a direct correlation between platelet dysfunction and vaping. Although our patient may have had a direct inhalation injury from vaping that led to her DAH, does not completely explain why she had been having hematuria. Oh, there's no complications during her cesarean section, nor did the patient have abdominal or uterine bleeding that would suggest otherwise. So it sounds like it's localized to the lungs, ergo logic would assume it had something to do with the fact that you're puffing on that chemical compound that nobody quite knows what to do with. Well, I got a solution for you. Put that shit down before you end up killing your kid. So yeah, if you needed another reason to steer away from those goofy chemicals, now chalk that one up, because they're coming for your kids. So with all that said, thank you all very much for the gift of your time. I've been Don Consuelo. I want you to follow your gut and get after it. Take care, everyone.